So now we're going to cover our developmental portion of the course, which is going to go in very well with the reproductive section. So a lot of what we will talk about with reproduction will make sense in relation to the development. And this is a pretty short content. First, we're going to start off with cerebral palsy. By definition, is a non-progressive abnormal brain function, meaning it's not going to get worse as time goes on. I will say, as individuals age and grow and develop, sometimes we notice things with cerebral palsy that we didn't notice before. So it's not necessarily getting worse. For example, let's say you've got an individual with cerebral palsy. As a newborn, they've been diagnosed or very shortly within the first few months of life. And then when they begin to learn to move or try and crawl, then we may notice that they have issues with mobility that we didn't notice when they were younger. Or as they get a little older and they're going to learn to start to talk, they may have issues with that we were unaware of until that milestone of being able to really start to verbalize. And so it's not gotten worse, we just haven't noticed those symptoms yet because they're growing and developing. But by nature, it is non-progressive. There are lesions on the brain, and where those lesions are located is going to depend on the signs and symptoms for that individual. And it could go from being very mild to pretty significant and severe. In patients, it's pretty common to see abnormal motor issues as well as postural issues. Those are kind of the two hallmark areas that we see. And of course, depending on where that lesion is will depend on how significant it is and what type of signs and symptoms that they exhibit. About 2 out of every 1,000 live births into being diagnosed with cerebral palsy, so relatively common in a lot of times we don't know the cause of cerebral palsy. Sometimes, and there are some theories, and sometimes we can relate it back to hypoxia, particularly in utero or shortly after birth, toxins, particularly exposure to maternal toxins while that baby is growing inside mom, sepsis either in utero or shortly after delivery, and then kernicterus, which when you get to the newborn content, you'll see that. So that's very, very high levels of jaundice or elevated levels of bilirubin in the blood can actually cause cerebral palsy too. Like we mentioned, it can be anywhere from mild to severe. These patients are predisposed to aspiration pneumonia and urinary tract infections. So if you're taking care of a patient in the hospital, no matter what age they are going to be predisposed to those issues. And so that's going to be big teaching points and things for you to consider when you're taking care of these patients, particularly if they're going to need urinary tract catheters, or if you're feeding them, suctioning them, all of those things to consider that they are predisposed to those issues. One way we help these patients are through the use of assistive devices. So braces, or it can be wheelchairs, motorized wheelchairs, walkers, all of those can be beneficial for these patients. Orthotics to help them be able to structurally walk better. Feeding tools a lot of times are used to help decrease that risk of aspiration pneumonia. And then splints as well to help with that mobility. The goal is for us to get them to a point where they can function as normally as possible and as independently as possible. And depending on how impacted they are with cerebral palsy will depend on what the specific goals are for that patient. Sometimes you'll see medications used. So baclofen is one. That medication decreases spasticity. And then you'll see anticholinergics, which help decrease or dry up the secretions. And then it helps with some of those unwanted movements or tremors as well. There are some surgical treatments that are used. Typically, these are things orthopedic in nature to help lengthen tendons, release certain tendons or ligaments to help decrease the spasticity and allow them to be able to move more freely. So you may be, particularly if you work in a children's environment, you may be taking care of patients post-surgical from those type of procedures. Physical therapy, occupational therapy are huge resources for these individuals. So you may be asked to kind of help find some of those resources and help them be able to access those available.